fetal circulation. For exchange of gases, fetus is dependent on the placental circulation. In the fetal life, heart assumes its four-chambered shape by the end of 6 weeks of intrauterine life. Additional vascular structures in the fetal circulatory system are ductus venosus, foramen ovale, and ductus arteriosus. Ductus venosus provides low resistance bypass between the portal vein and the inferior vena cava. The foramen ovale is a small hole located in the septum, which is the wall between the two atria of the heart. Ductus arteriosus is a normal blood vessel that connects two major arteries, the aorta and the pulmonary artery in the fetal period. Oxygenated blood in the placenta enters into the fetal circulation through the fetal umbilical vein. Through the bypass, that is ductus venosus, in the liver, it directly connects with the inferior vena cava. Blood enters into the right atrium. From here on, it has two pathways. 1/3 of the blood enters into the left atrium through the foramen ovale. Rest 2/3 blood mixes with the venous return from the superior vena cava and enters into the right ventricle. Blood entering into the left atrium. This blood mixes with the small amount of the blood that is reaching the left atrium through the pulmonary veins. Blood passes into the left ventricle. Blood is pumped into the aorta. Through the ascending aorta, blood distributes into coronaries, upper extremities, and the head. The 2/3 of blood that entered into the right ventricle, this enters into the pulmonary trunk. From here, small amount of blood enters into the pulmonary circulation, whereas majority of the blood passes into the descending aorta through the ductus arteriosus. After birth, there is reversal of the pressures. That is, pulmonary vascular pressure decreases, whereas systemic pressure increases. The foramen ovale, ductus arteriosus, and ductus venosus closes. Closure of these structures has two ways, that is, functional closure and the anatomical closure. In functional closure, umbilical vessels close first, and then ductus venosus, foramen ovale, and ductus arteriosus. In anatomical closure, umbilical vessels close first, then ductus venosus, ductus arteriosus, and lastly foramen ovale. Hope this video helped you. Thank you.